January 27th, 2015, we're here with Linda. And Linda has a myriad of complaints. She's had dental problems with significant infections and implants. She believes she has adrenal wasting, low energy, and it was tough for her to get here. She's been around and seen a lot of physicians. And her history for me is morning is her best time of day. Mm-hmm. She can miss a meal without any problem. And for me, that doesn't sound like adrenal. We know she's got thyroid issues as well. And in my history, I found out that she had a partial right lower lobe was removed mm-hmm. at age 30. Mm-hmm. And she has a scar, which I'll put on a better shot. But she'll let me right now show you this area right here, the scar, which I just injected. And that's the reason for this video. She had a scar which tested positive, and the viewers of my YouTube channel know I go after root canals, but I go after scars too. We just did the scar as one could see. Linda, what do you notice?
What I noticed is a lessening of my eye tiredness and fatigue. And I feel it mostly like a little surge of energy, and mostly in my eyes. And my head, like a clearing of my head. Yeah, I feel better in general. Like a light switch went on.
Like a light switch, like a switch got...
Like a switch.
Yes.
Exactly.
And that's exactly what happens when we treat what's called an interference.
Yeah,
field.
I knew something in my body was different.
Okay.
Uh-huh.
I'd like to post this on YouTube, depending upon how we see you do in the next couple weeks. Is that okay?
Yes, it is.
Thank you very much.
You're welcome.
We're discussing your case a little bit more in depth. You're telling me that you had a lot of pain in your gallbladder area, right?
Chronically, yes.
Chronic?
Yes.
For how many years?
I'd say for the last 3 years.
Okay. Certainly not before you had that scar, right?
Oh, no.
And you also feel better with coffee enemas, correct?
Oh, I feel fabulous.
With coffee enemas?
With coffee enemas.
Which supposedly help liver and gallbladder, correct?
That's correct. And I would see the gallstones from elimination. I'd see the gallstones, all these gallstones.
Now, suppose I told you that large scar you had cuts across your gallbladder meridian.
That makes me very happy.
It wouldn't make me happy to have it, but it would make you happy to know that can be an issue,
well, that's
right?
exactly right.
Right.
Yes.
It's an issue.
Everything that you've talked about regarding the scar and the effect it has on me all coincides with all my symptoms.
Right. And injecting it with Procaine, all it does is it resets the nerves that are cut along that scar.
Right.
And in acupuncture theory, that can help the meridian recover, and you can regain function, and it can be instant. It's called a lightning reaction.
Well, that's what I had. And I want to tell anyone that views this that it's not painful, the injections. So don't be afraid, because I thought it was going to be extremely painful, and it is not.
Oh, you handled that like a pro.
Yeah,
it was phenomenal.
It was great.
Thank you. Again?
Dr. Rowan was speaking to me, giving me the summary of how the scar has affected my health. As he was talking, I didn't want to interrupt him at that moment, but it was deja vu. This setting replayed itself, that I had already been here, I had already seen this man, and
Meaning me?
Dr. Rowan, this man, I say it that way out of a heartfelt love for this man, that I'm going to walk out of this office and I'm going to have my health back. And I saw it while he was talking to me. The whole scenario played out, and I had been there before. So it was in my future, and my future just came today.
Wow. How do you feel now? We're about 5-10 minutes away from the injection. Do you notice even more changes?
Yeah, I feel a clearing, just a clearing of, in my energy. Oh, and this is the nervousness or the stress that is just normal, and nothing has to happen to me to cause it. It's the way my body is in this hyperactive mode That's gone. And that is huge.
This book was one of my Bibles in my early days. It's called Manual of Neurotherapy According to Hunecke. Hunecke was a German physician who discovered that scars can really screw you up, and when you treat them with Procaine, you can get what's called a lightning reaction, and the body instantly resets. It's like pressing the reset button on a tilted computer. Does that make sense?
It does. I didn't add that I can define it better now. The stress has left my body. Yes, I have a calming.
Good.
Even though I'm excited.
Oh, you're excited because hopefully you're going to be on the road to health.
Well,
now.
I believe it. Yeah.
Good.
I feel like I know it now.
All right. Thank you.
And this has been after 35 years of going to some of the very best doctors.
Of course. And I took your history.
Yes.
And your timing related back to the time of that surgery, right?
Yes. And you went to the root cause. You went to the root of my history.
Yeah.
Which now makes so much sense, and why no one else could connect the dots before.
I'm a detective.
You're a detective.
I like to go back because I said, when is the last time you felt healthy? You remember that was the first question I asked?
Yes.
And you said about 35 years ago, and it was before that surgery, correct?
Yes. And I want to add, too, that many people have tried to persuade me to go to other doctors and to keep trying, but because of some constraints that I have, I did not do that until my daughter told me about Dr. Rowan, and I knew that I should come to him. So this was all divine intervention for sure.
Well, that's very kind of you. Thank you.
Absolutely.
Today's date is February 3rd, 2015. We're back again with Linda, who has very, very graciously allowed me to video her again because today we have some intimate things to discuss. But first of all, we did your a lung scar on you the other day.
Yes.
What's happened to you since we did that? What have you noticed?
Well, during the treatment, do you want me to tell you that again or after? Because I did take notes. I logged. I logged for a few days, but with time constraints, I'd like to tell you everything. But since I left your office 1 week ago, instead of having a sick kind of exhaustion that left me flat out, I've had some fatigue with no more sick exhaustion. The fatigue is actually a good sign because from the drops, the micro drops that you gave me to detox, I'm detoxing, and I feel healthy and normal again until today, where I thought I was healthy and normal from the scar Procaine treatment, but after the treatment today in the pelvic area, there was a lot of unfinished business that Dr. Rowan had to take care of.
Let's talk about that. Your scar tested negative today, and you felt much, much better, correct?
Oh,
like
it's
dramatically better.
Dramatically, yes. Like I said, I logged. I don't remember it right now because there's a lot going on when I come to see you. But lots of things left me that I had that I can't even remember.
Lots of things left you. That's what these treatments do. By releasing the interference field, the things that your body are storing, get released. Now, you have some pelvic trauma too, and you've permitted me to video you, and I appreciate that. You had D&Cs in the past, correct?
Mm-hmm.
When you were younger, you had an abortion too,
Mm-hmm.
correct?
Mm-hmm.
And today we found an interference field in your pelvis with muscle testing, correct?
Correct, which I didn't even know I had.
Right. And the reason I got directed to that was you were telling me you were having a lot of bladder issues, going to the bathroom all the time, right?
It was almost torment. It was that extreme because it was all day long. And if I didn't do things just a certain way during the day, it would be all night long. It could be every half hour.
I just did your pelvis. It's still too early to know what's going to happen with your bladder.
Right.
Although we may know within a couple hours. But what do you notice subjectively since I injected your pelvis?
The whole area from my stomach down to here is just, it has these sensations, but I think like it's so hard to explain, but you feel like your body's just doing what it needs to do, like it's clearing it.
Like clearing, like a release.
It's a total release. I felt it in my eyes. I felt it in my body, my whole body. Initially, like a switch went on, just like with the scar therapy.
That's called a lightning reaction.
A lightning reaction.
It's a switch.
A switch. And I still feel it. This treatment, I feel a lot more activity than with my scar, but this had the ozone, which my scar did not.
Right.
But it's in my spirit, in my being, I'm feeling like what was injected in me is just going to work to take care of the problem that was there, that was unbeknownst to me, that I had this pelvic problem, but now it all makes sense. That, and again, this was in my 30s when
you had all this happen to you.
Yes.
What I injected today was Procaine, which is a local anesthetic, and then I followed it with ozone. And the purpose of this is to try to treat energetic disturbances that were in your pelvis that could go back many, many, many years. And you've noticed a significant change already?
Yes, and even in the vaginal area, I feel it's doing something there. I did have a history of infection. The doctors would never see it, but I would always have tissue there, and I would always see that there was infection because there was color, and it was like it was green and yellow, and they'd say, "Oh no, we don't see one thing wrong with you," and I thought, well, that doesn't seem normal, and so I lived with that. So I never even mentioned it to Dr. Rowan because it's really minimal now, but I'm sure it's because I'm older. But it was never any infection like a lot of women have. It wasn't like that nasty yeast and that, but something was draining.
And something just didn't feel right. And maybe that's how it was manifesting, because there was an energetic disturbance in your pelvis due to all the handling of your pelvis many years ago.
Well, exactly. And to be honest with you, I was numb to the fact that there was a problem. And I was so used to it that until I got the treatment did I realize there was a problem. And now with the feeling I'm having now, and very much even it's coming to the outside of my vaginal area, the feeling. So
a good feeling.
Yeah, no, a good feeling.
Right.
Yeah.
Right. Now I want the
viewer. Yes, it's all good.
I want the viewer to know we didn't inject your vagina. We went here, right above the pubic bone. Correct?
Correct.
And it was not that uncomfortable an injection.
No, not that bad at all.
This is a new technique that I learned, and it's probably going to replace what I had been doing before, which required actually going into the vagina, which was not a bad injection in itself. Extraordinarily safe, actually very easy on the woman. I just don't like doing that kind of pelvic exam if I don't have to do it.
I probably wouldn't have had one. Probably, maybe not. It wouldn't have been something that I really would have been able to say yes right away. So doing it on the outside of the pelvic area part was very, very easy, yes.
Okay, thanks.
Non-invasive and comfortable.
Well, I'm going to check up with you probably tomorrow or the next day to know how this is done for your bladder, okay?
Oh, absolutely.
Thank you.
You're welcome.